Welcome everyone to today's webinar, Post-Pandemic Decisions Accelerate Pace of Patient Access, Engagement, and Digital Experience Outreach. My name is Brian Zimmerman with Becker's Hospital Review. Thank you so much for joining us today. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. And at this time, it's my pleasure to kick things off here by introducing our moderator, Matt Grechko, who serves as the Senior Vice President and General Manager of Healthcare and Life Sciences at Silverline. Matt is responsible for driving the growth, strategy, and industry eminence of Silverline's Healthcare and Life Sciences practice. Matt, take it away.
Great. Thank you so much. Good afternoon, everyone, and thank you so much for joining our webinar today. Before we get started, I'd love to introduce some of the other participants of our call here that will help drive a lively panel during this presentation. First, I'd like to introduce Olivia Go-Kidder. She is the Director of Customer Relationship Management at India University Health. David Bradshaw, who is the Senior Vice President of Consumer and Employer Solutions at Cerner, as well as Dr. Geeta Nair, Executive Medical Director at Salesforce. For the discussion today, we're going to be starting with some slides and content to discuss some of the topics that we've outlined in advance around sort of post-COVID, post-pandemic, how we're seeing a focus on patient access, engagement, and digital transformation. From there, we're going to do a lively panel where we'll be asking some of our panelists questions about their experience and the like. And then from there, we'll open it up to a broader Q&A for everyone that's on the line. So with that, I'd love to get started with some of our talking points. We're going to talk about first is we're going to actually talk about a little bit of the timeline that providers have gone through over the last 50 years or so. As we know, starting in around the 1960s and 70s, there was a huge focus on paper-based records, right? Everyone's familiar with that's where it sort of started. From there, as we got out of the 60s and moved to the 70s, we started to see HIM systems and ENR start to emerge, but it was obviously very early within sort of that technology adoption life cycle. From there, as we saw the advent of personal computers arise, we saw that for physicians and their associated practices and offices, there's an opportunity for them to actually start using this new technology to drive better services. As we continue through the decades, we start to see some additional benefits that ultimately will lead us to our conversation today. In the 1980s and 90s, we saw the benefits of the EHR, however, they were not yet widely adopted. When we get to the 2000s, we saw high tech as well as the standards around meaningful use starting to really drive significant change and also change the model by which these technologies were required as opposed to being optional. As we get closer to where we are today, we see that the Affordable Care Act as well as EHR adoption become commonplace, as well as there starts to be this growing need for organizations to look beyond the EHR in order to meet the needs and expectations of their patients. Then what does that mean? Well, as they start to look at, we have this transition to value-based care as well as population health, and those two items, coupled with a number of other changes, require some significantly different expectations. And so ultimately we land what we all know about and what we're all experiencing currently is 2020. We're not going to obviously spend the webinar today discussing sort of the clinical side of this, the history of it. Instead, what we want to focus on is, our perspective and our experiences as to now that this has occurred, it's enlightened and evolved some of the very fabric of the healthcare industry. And we're going to discuss where and how we're seeing some of the leading edge organizations refocus their intention in order to drive value-based care, drive the outcomes they need, but also start to evolve in a way that is super unexpected. And so that's ultimately going to have them focus on a few key areas, right? Those are patient access, engagement, and digital transformation. And we're going to talk a little bit about how we see those things working together, as well as some of the approaches that we've all collectively are taking to really elicit that level of change in a productive way. Before we get into what the solution areas are, one of the things that we wanted to talk about today was some of what we see. We're overwhelmed by social media and various tools in the news and TV and all these different access points for information these days that it can get overwhelming. And so we hear all these, incredibly compelling terms that often don't have well-defined definitions, and we start to, understand and try to determine, where do I focus? What should I, really emphasize? And so engagement and segmentation and social determinants and AI. And for every one of these terms, and there's plenty more that sits behind these, what we're seeing is that while these are incredibly important for us to solve and incorporate into our strategic focus, one of the other areas is that for every one of these particular areas, we're also seeing a certain technology pop up around it. Now, certainly no one has any desire to stifle the investment and the creativity of technology products within the healthcare landscape. What we do have to be conscious about is, how do we continue to drive a model that is much more focused on an approach where you solve multiple problems or multiple situations with one technology, as opposed to having to buy one singular technology to solve a singular problem. And so where that ultimately leads us for part of our presentation today is around how certain platforms, specifically today we're going to discuss a little bit about how Salesforce serves as a platform to really solve a variety of those items that were listed as those terms, as well as integrate and extend some of these applications that may already be in place to solve these niche problems or are being utilized moving forward. And so that ultimately leads to this, sort of overarching theme around moving from point solutions to enterprise platform solutions. And to be candid, these are not a change, right? This happened 15, 20 years ago. There's a very big focus on identifying specific applications to meet specific needs. Then we saw the EHRs came in. They started to create that platform approach for the clinical side of the house. And now we're starting to see a similar transition for the engagement side of the house. So as an organization that's dealing with, the current pandemic, dealing with the fact that there's large mergers and acquisitions, there's increased patient expectations, there's pressures from a financial perspective, and a host of other exterior factors, we decided today to say, hey, where do we believe you're going to need to focus, and what do we think are the most refined areas that are going to drive real transformation within your organization and deliver the type of results and value that you think are going to be incredibly important. So the first area that we want to focus on is digital front door. And these topics that we're going to discuss are in a natural order. We do believe there's somewhat of a sequence, but it doesn't mean that you necessarily start in one place versus the other, but they do have interactions that are important between all of them. From a digital front doors perspective, what we're talking about is the digital access point to services for patients and providers. This may mean devices that they're already using in their daily life, like a mobile device, but this also refers to areas like telehealth. And I think what we're starting to see is things like telehealth, while historically those were relatively optional or sort of new, we're starting to see that telehealth is becoming somewhat of a norm, and people are actually defaulting to that capability where telehealth is actually health now, right? It's just an expected channel. And so the digital front door for us is this heavy emphasis on mobile. How do we take all of the various services, all the various activities, and all the various content and material that patients and providers might use and give them a much stronger and much more engaging digital experience? From there, we think about if you have a really good digital front door, that allows you to improve the overall access that patients have, right? And when we talk about access here, what we're talking about, and many have said this, and we'll continue to reiterate, is how do you give patients and caregivers the right information at the right time in the right way, right? That's really, really important. But a secondary thing that we're talking about with patient access is how do we start to consume data and leverage that data to inform those activities, right? That's really, really important here, right? It's not solely about giving them the access. It's actually making sure that what you're presenting to them and what you're suggesting to these patients is important both when they're sick, but also when they're healthy, so they get this very curated journey and experience. And so we've said we start with this digital front door concept. You improve the overall access that these individuals have. From there, you move into the ability to do greater care coordination as well as the ability to close gaps in care. We're going to talk about a little later how you do that in terms of sort of the ideal state. But again, I mentioned this reference to data. Well, now we're talking about harnessing all of that data, layering on additional data on top of that, and figuring out ways to better navigate patients and establish that journey where you're coordinating their care before, during, and after a clinical episode, as well as the associated communications and channels that are being leveraged throughout that. And then finally, what we're going to talk about is patient engagement, right? So again, if you're able to effectively coordinate that care and close those gaps in care, Now, we're ultimately leading to one of the most significant inputs to patient engagement, right? The patients want to be involved and they want to be interacted with throughout their health journey. And so our desire here is to create lasting relationships with the patients and also build loyalty and trust, right? And so in order to do that, you need to establish some of these other frameworks that allow you to make sure that every interaction that you're having with that patient is driving the right results, right? Ultimately, patient engagement, higher satisfaction, and that drives what we all know are incredibly important parts of an individual's healthcare journey. And so as I said, while those things are all individual, the question is, if you focus on those 4 areas, well, how do we do that effectively? How do we make sure that my focus in those 4 areas is actually going to produce the results that we're looking for? And so what I'd like to take a minute discussing is what some of the things that we're doing at Silverline, along with many of our partners in the technology, to make sure that the investment that organizations are making in those 4 areas produce the results they're looking for. And there's really 2 key areas that we see changes occurring. One is we're making sure that everything we do from a solution perspective is much more focused on the experience. And so there's this new model of focusing on experience design, and these screenshots try to demonstrate what that looks like, where you think about individuals that'll be accessing the system from a persona basis, right? As a patient, what is the experience that patient should have? And you actually build out the journeys, you build out the steps and interactions that a person would have, because that helps you make sure that the way in which you implement that technology is going to produce the results that you're looking for. And you can think about the same type of persona as a provider. Maybe it's the payers you interact with, maybe it's a therapist, maybe it's a call center agent. And so you start to really take an approach that's much more focused on the experiential side of the house as opposed to pure play requirements to get a business activity done. Ultimately, you will get to that result, but it's a much more effective way to drive the outcomes that you're looking for. The second way that we're able to really drive the outcomes that we're looking for is to make sure that we, as a consulting organization, are providing clarity into what is this effort going to take. And so what we're able to do now, and we'll call them bundles, is we're able to take all this information, right? For example, if you're focusing in on patient access, what we're able to do is leverage the tens of hundreds of implementations that we've gone through and say, this is what it looks like. This is a defined timeline. This is the defined metrics that you need to focus on. This is a defined investment. And ultimately, that gives the organizations we work with a lot of clarity and a lot of insights into how they can get this done, how do they build the value prop initially, but even more importantly, get a realistic understanding that many of these initiatives are not multi-year initiatives. These are actually months at a time. And I think that is a fundamental shift that we're seeing in healthcare that other industries have already gone through, is the ability to elicit some really significant change and really beneficial impact in a shorter period of time. So we've walked through at a high level the transition that the providers have gone through over time. We've talked about the 4 key areas that we think are solution areas and really strategic focuses that you have, as well as what's the renewed approach to get there. The final area that I'd like to talk about before we get into our panel is, well, what is that end state? What is that ideal state that we want to try and achieve? So I'm going to walk you through a slide here that builds a little bit to tell you about that. So the first area that we're spending a lot of time, and I've discussed earlier, is around data. Within healthcare, as everyone knows, there's no shortage of data, and those data sources continue to expand. You have EHR data, you have mortality data, labs data, pharmacy data, HIE data. All of that data, while it's incredibly powerful, it's not as useful unless you're actually curating that data and pushing it into the right systems where you can actually execute on that information and drive workflow. And so one of the first steps that need to occur is once you identify all of your data sources, you actually need to take that data and now cleanse it, right? Now, we're not going to spend a lot of time on this webinar discussing the various steps, tools, and methods for cleansing that data, and there's certainly some complexity associated with it. But again, understanding the need to consolidate that information into a singular location, cleanse it, and really understand that that data is validated, endorsed, and can be utilized is very, very important. Once you do that, you're able to accomplish some really important things. Now, for today's discussion, we're going to call it Patient 360 and Provider 360. Certainly, there's other data sets that also can have this consideration of 360, but what we're trying to get to is a holistic view of this information now. Many others may refer to Patient 360 as a longitudinal patient record. Very similar here, right? What we're trying to get to is, do I have a holistic understanding of the patient across all the various channels and interactions that that patient has with our particular health system, our organization, our services. And if you do, that now gives you the opportunity to interact with that patient in a very different way. On the flip side of that, everything that you're tracking about the patient is also relevant to the provider, because those patients are seeing your providers, they're seeing your clinicians, and so ultimately these data sets play off of each other. It's really, really important for them to operate directly with each other and make sure that for a patient, you understand everything about them, and for a provider, you understand everything about them, so you can start to drive some really impactful interactions, some really impactful experiences. And so this information for a patient or provider may be coming from multiple data sources, but the goal is to start to consolidate that information and really understand all of the touch points. Once you effectively do that, that's when we start to incorporate this layer of the CRM, right? And so using an application like Salesforce, right, it really gets you to achieve 4 key additional benefits, which is really where you start to drive the outcome and the experience you're looking for. First of all, you can layer on another layer of data, right, which is social determinants data. This is information that is typically not tracked in a lot of those source systems, but is incredibly important to the way in which you deliver care, right? Environmental things, right? Obstacles to delivering care, right? Those are very, very important to make sure you're delivering the care in the way in which that particular individual needs. And this concept of personalized or curated healthcare experience should not be a surprise, right? You can use whatever example you want from, you know, any of the leading applications, right? Take Amazon and others, right? But everyone is looking for a more curated and personalized experience. That has been coming to healthcare for quite some time, but the tools are now available to make that a reality. The second area is now that you have all this data and you have this tool that's acting as this engagement layer, now you can drive some significant workflow. I think historically in healthcare, workflow is seen as a bad term, right? It seemed like, well, if you're doing workflow, you're not focused on the patient and you're not being personal. And I don't think that's true at all. Workflow means we're allowed to actually drive efficiency and effectiveness into the process. One key metric that I'll reference that I think speaks to this really well is historically, many people focused on for patient access in the call center, how quickly you could get someone off a phone was a metric that was very, very important. What we're seeing in healthcare now is because of workflow and because of insights and data that we have, a more important metric is what value are you driving out of that phone call? And if that person or patient stays on the line for 30 more seconds, but instead of just booking them an appointment, you also are able to schedule a flu shot, you're also able to have them pay a bill, and you're also able to answer 4 other questions, that is much more beneficial than just getting them off the phone as quickly as possible. A third bucket is analytics. Now that you have all this data in one place, you can leverage the power of the platform through the analytics capabilities that it has to start to actually drive business decisions, right, based on real-world data. Then, as we all know, and certainly is something that is coming to healthcare, is artificial intelligence. Now those analytics can be driven by models and algorithms that consolidate all the information you have and make it even smarter. And so rather than have to diagnose and analyze that information, the artificial intelligence is telling you things that you should be doing, why you should be doing it, where you should be doing it. Now, certainly there's a difference between using that for clinical reasons as well as operational reasons. But again, the ability to infuse that additional layer on top of the platform is going to be very, very important here. And again, there's a variety of different use cases where artificial intelligence can be leveraged. We'll talk about it in a second here with the ideal end state outcomes. But again, understanding that we can drive certain models and algorithms that learn based on data that you have, your data, your experiences with your patients and your providers, ultimately allows you to have an organization that is going to execute in a way that really can achieve the goals that have been outlined. So the final landing place that we have as you follow through this path, we've consolidated into what we believe are 6 core benefits. Certainly understand that there's plenty of other benefits, and we tried to bucket these in a logical way. But I would like to run through those 6 benefits right now. The first one is multi-channel communications, right? What we're talking about here is, in a platform like Salesforce, leveraging their marketing capability, you have the ability to communicate across phone, chat, email, and text, right? But more importantly, not only can you communicate across those channels, you can actually establish a journey, right? An experience. That experience can have branching logic. That experience can be based on prior interaction and prior data sets that based upon how someone interacts with you, you can curate that experience. And so you might say, if they book an appointment, 3 days later, I want to send an email. The day before, I want to send a text message, and the day of, I want to call them. And so it's really, really important to establish a mechanism that not only can you communicate with a patient, but can you communicate in the right channel in the right way. And what we've seen in working with our customers during this pandemic is the organizations that had very robust communication tools were much more prepared to interact with their patients during this time, whether that was to tell them that some of their locations were closed, whether that was to communicate with them after a hospital admission and check in on them and see how they're feeling, or possibly to notify them that telehealth services are now available. It was incredibly important to be able to do that quickly and rapidly at high volume. The next one, as I mentioned, was around insight, analytics driven, and a good example here is next best actions, right? And so this is a new term, that's been part of a number of other industries, right? But think about if you're having an interaction with a patient, right? Wouldn't it be great that based on everything you know about that patient, you're being told what you should talk to them about, right? You're being told, hey, they have not had a flu shot, so we should talk to them about a flu shot. This patient has not had their annual wellness visit, so I'm going to let you know you should be talking about their annual wellness visit, right? And so now we are curating that experience, but we're also attaching a value to that and saying, here's all the open things that you should be talking to this patient about, but this item is number one value. And that value indicator can be based on a number of different inputs, but again, the AI and the models that are being developed are helping you drive that so that you're utilizing the right things at the right time when talking to a patient. Another one here is closed gaps in care. This is a good example where our partners on the phone, Cerner, have helped out tremendously. They have their Healthy Intent platform, which is a population health platform that is curating a lot of different data sources. They're pushing that into a product that feeds into Salesforce and allows us to have clinically informed information to close gaps in care for patients. Once those gaps in care are closed, that information feeds back to that platform and continuously learns. That's really, really important as we think about driving more value for our patients and also keeping them healthy. Finally, you'll see enhanced coordination and collaboration. No surprise, the more access you have to data, the more access you have to these engagement tools, the more you're going to allow individuals, both internal and external to your organization, to coordinate. Internally, it might be multiple providers, or it might be a call center agent and a nurse if you need to do triage. Externally, if you think about caregivers or other specialty service providers from a referral management standpoint, it's very, very important for you to provide the tools as well as the information. Technology-enabled engagement, I sort of discussed, I was talking about multi-channel communications. Here again, I think it's talking about leveraging all of these tools to drive engagement in new ways and having a consolidated approach for doing that. And then finally, market expansion framework. This might mean a lot of different things to a lot of different people, but think in one instance it might be physician recruitment, and another it might be patient acquisition, and another it might be expansions of service lines. At the end of the day, if you follow this model and establish this framework, we believe that you're able to achieve these 6 things, but ultimately we believe right now, all things considered with the current pandemic and the current path forward in healthcare are critically important. So with that, I'd like to now move over and we're going to spend some time with our panelists, ask them a few questions around their experience with these type of solutions, as well as other areas that they can add value as you continue to evaluate where and how you can drive some of these changes. So with that said, I'm going to bring up a slide here, which references our panel. Great. So Olivia, I'd love to start with you. So I have a few questions I'd like to ask you. First off, what has worked best in implementing your patient engagement strategy at IU Health?
Hi, Matt. It's, so easy to look immediately to technology to solve a problem. And, looking at your slide with all of the logos, there are so many solutions out there, all competing to be the silver bullet for you in some regard. So the thing is to just be very, very important what you add to your tech stack. One thing that has worked extremely well for us is having a strong vision and strategy for CRM as part of our patient engagement strategy, so that we can lead the exploration of solutions from the point of view of what will serve our goals best versus how do we bend ourselves to get value out of this new tool. Aligning our patient engagement strategy with our system's values and our mission of making Indiana one of the nation's healthiest states has been a great way to, rally people around CRM. And then also having physician championship of the strategy, right? And then along the way, we've engaged our internal subject matter experts very, very extensively to get inputs for every campaign. So these have all worked well for us.
Excellent. No, that makes complete sense. So another follow-up question there. So as you talk about, what has worked best, what are some of the biggest lessons learned, right? You had a defined strategy, you had champions, but what were some of the lessons learned throughout the process?
I think the first lesson that I learned was that you've got to know your data, what it is, what it isn't, and then what are the limitations, right? And then how you can mitigate those mitigations. The other thing is don't try to boil the ocean. When you're awash in data and a new platform, it can be very tempting to try to do a lot at once or build a really complex patient engagement journey and just try to do it all. By all means, dream big so that you're always stretching yourself. But I think it's also important to stay focused with patient engagement goals that can be defined, that can be tested, and that are achievable, right? So it's okay to go live with something attainable with whatever you've got. Just go live with something, get some initial learnings, optimize, and then you can keep repeating and getting better with every version.
Great. Yeah, and I think that makes good sense because I think we often see organizations think that complexity leads necessarily to better outcomes, and I think often it's sometimes the simplistic journeys that actually have some immediate value. And so with that said, given the strategy that you all employed, what have you seen, and have you seen any, initial outcomes and benefits of, the work that you've gone through and implemented?
We've seen a sustained increase in patient retention in our primary care panels, and that's a crucial first step to just being able to care for our population and our community. We're also expecting to see increased closures and gaps in care.
Great. I think I have one more for you, and then we'll certainly move to another panelist, and I can't go through, given the title of this presentation, without one question around it. So, being part of, a large, academic health system, curious from your perspective, how has COVID directly impacted those plans, both for now and the future? Really curious on your experience so far.
Well, in the first, definitely it was very disruptive. We paused a number of things while our system pivoted to manage COVID. But, so many months in, our patient engagement goals have not changed, right? We still want our customers to lead their most healthy life, and we want to partner with them and reach out to them in a way that's informative, personally relevant, without ever. As we open back up our system to provide routine and elective procedures with COVID, it has really made it more important that we plan our outreach to our patients with optimal timing, right? So if we have a demographically informed patient profile, sure, we can message to all women ages 40 and over to remind them to get a mammogram. But then it is more precise if we can use a clinically informed patient profile to only message to women who are truly due or overdue for a mammogram. So we're, in that sense, we're also meeting our patients where they are, timing our outreach so that we serve our patients better, and then allows us to prioritize access to the patients who need it most.
Excellent. Well, that's fantastic, and I'm sure there'll be some questions that arise during our Q&A that you can answer directly, but I appreciate your thoughts on that. So with that, I'll take a little bit of a transition here, and we're going to turn it over, to David from Cerner. So David, a few questions for you as well. The first one is, how have you, specifically from my reference around, healthy CRM and gaps in care, how have you seen your clients, streamlining the time to value by closing gaps in care based on those clinically informed data sources that we discussed?
David, you may be on mute.
Well, you know what? I am on mute. I do apologize for that. So Olivia hit it right on the head when she talked about the clinically informed CRM platform, and that's actually the work that we've built inside of a solution we call the Healthy CRM product, which connects Healthy Intent, which is one of Cerner's two big data platforms, Millennium, which runs in the hospitals or the doctor's office, but Healthy Intent is the layer above the EMR, Cerner, Epic, anybody else's. And we've connected the clinical data and the clinical insights that are calculated in these big quality registry systems. We've connected that into Health Cloud to allow clients then to run their campaigns on clinical data. The calculation of who's a diabetic and who's not a diabetic is actually a very clinically deep calculation of who has that disease and who doesn't. And that data is always changing, Matt, and that's one of the things that we think is the unique value proposition here that we've created in being able to connect those two data sources.
Yeah, no, and that makes great sense. And so, you sort of alluded to this a little bit by clarifying sort of the difference between, healthy intent as well as Millennium. So, one of the things that we've noticed, right, is that, Cerner provides, some real depth and breadth around solutions for the industry, right? And so your strategy, has evolved, whether, from perception perspective or reality, right, from being solely, an EHR to actually being a comprehensive health platform, right? And I'm curious from your perspective, how has the market responded and how have you seen your influence in the industry because of that strategy?
Yeah, well, Matt, Healthy Intent works across multiple platforms. We have it all the way down into small employers. We have a construction company in Kansas City that has 2,000 employees, and they run a Healthy Intent for their business. We get all their paid claims. We run the wellness program for all that data goes in there. And we're actually using Health Cloud and Salesforce to deliver customized messaging campaigns to that construction company. That's on the low end. And then you go all the way to the high end, of course, where we're across multiple EMR platforms and large integrated health systems, states, Medicaid, state programs, and even the federal government with our VA deployment. And so the scalability of Healthy Intent really becomes a network, health network data foundation layer that supports these big networks and integrated networks that are coming together. Great.
No, that makes a lot of sense. And so the final question I have for you, and again, you referenced Health Cloud a few times, and for those that are on the line, Health Cloud, Salesforce is a platform. Health Cloud is the healthcare specific application that sits on top of the platform that has, certain capabilities, components, and assets specific to whether you're a provider, obviously for a majority of the audience today, but as well as for payers and life science companies. So one of the things that you referenced was, a lot of different organizations and industry health leaders have taken, different CRM strategies, right? Some have acquired an application to fill the gap on CRM. Others have decided to build their own. Cerner has clearly chose to partner with Salesforce. And so I'm curious from your position and your role, can you just share some initial insights, on the decision and the overall impact that you're seeing on your clients from that?
Yeah, well, I think, Matt, at its core, we fundamentally believe that CRM would move across the enterprise, and it was more than just a clinical use case. You talked earlier about the omni-channel communications, and I think the Cerner made a strategic decision that instead of building something that was going to be rolled out and built at the enterprise level, we were going to partner with it. And we went through a pretty exhaustive analysis and ended up with this partnership with Salesforce. Now, everything in a partnership isn't always easy. There's opportunities that we both can work better on. But, we've had some really good success with clients, and I think that this clinically informed CRM becomes a major differentiator going into the future.
No, that's great. And I think one of the things that this also illuminates, right, is, we, especially, at our organization, Silverline, have just tried to dispel the myth that, it's EHR versus CRM, right? I think, the market and the industry needs to recognize it's EHR plus CRM, right? And I think Cerner has sort of shown that the benefits that can occur if those two work tightly together. So thank you so much for that.
I think there's... go ahead.
Yeah. No, please.
No, you go ahead, Matt. Great.
Okay.
I agree.
Great. No worries. All right, so the final panel, I'd love to spend some time on, and then we're going to open it up to the broader group for any questions might have been raised. So, Dr. Yar, one of the reasons, we wanted to have you on this panel, and I think Olivia referenced it, David did as well, as did I, right, is certainly, the clinical side of the house is becoming a much more important input to the CRM and the value prop of CRM. And so, knowing that you are a clinician, I'm curious how you're helping customers, not just customers, but your own experience, navigate the balance of, continuing to deliver high-quality clinical care, while also recognizing the importance and need in real time to transform to the tools and approach to patient engagement. And how do you balance those two priorities? Not that they're competing, but they're certainly both burdensome, to say the least.
Sure. So first of all, thanks again for the opportunity to be on the panel, and thanks to Becker's as well. I think it's exactly what we've been talking about today, which is, clinically informed, right? Whatever solution we offer in the technology space needs to first recognize and understand what is the clinical problem that we're solving, right? So it has to all back into the front lines of care. And secondly, it needs to complement, right? We don't want to involve a new workflow. We appreciate that the EHR is the clinical database, and we're really looking to be the wrapper around that or the complement to that. So I would say that, again, it's clinically informed is kind of the right word, but also being an invisible technology that is not cumbersome and a burden to the doctor, the nurse, the care team.
Yeah, no, and I love that comment about being, transparent and not becoming an obstacle, right? If the technology gets in the way of what you're trying to do, then obviously the adoption is going to be impacted. And so that's a good segue to the next. Obviously we've seen this tremendous adoption of telehealth, as mentioned, in virtual health. I'm curious from your perspective, again, as a clinician, but also, being at Salesforce, what do you see as this adoption of virtual health fitting into Salesforce's overall solution strategy?
Sure. So, again, I think that COVID-19 has just really accelerated everything in the virtual and digital space. So it slides really nicely into our solution set around digital engagement. I think what's really changed is that virtual care, digital patient engagement experience, whatever lingo you want to use, used to be a nice to have, right? Now in this environment, it's a must have. And so we've seen an acceleration and an adoption. And I think the key is really, again, staying invisible to the care team, making sure that the clinical workflow that is not cumbersome, doesn't contribute further to physician burnout or care team burnout. And secondly, that we keep the humanity in it, right? Again, the practice of medicine is an art as much as it is a science, and it's not all about algorithms and analytics. You've got to keep that human factor. So what is the right balance of what should be automated, what should be virtual, and what needs to be in person and high touch? So it's just keeping an eye on that overall experience.
Right. Okay. Yeah, that makes complete sense. And so you mentioned, the human side of this. And so I think that leads me to the final question for you, right? And Olivia referenced this, pretty astutely as well. Engaging clinical leadership in many of these decisions is critically important, but it also is often those people that give you that human side of it to say, hey, you can go this far, but not there. And so the question for you is, being a clinician that within your own organization, but also, being part of a large technology provider that's trying to help drive these changes, what is your recommendation for an approach for engaging clinical leadership? What have you seen that has worked really well, and what have you seen that has led to failure in terms of getting them on board and willing to adopt these type of technologies?
Sure. So again, I would say everything that used to be a nice to have has now become a must have, and that chief medical officer, that chief medical informatics officer, your physician champions now have a seat at the table at the C-suite in a really vocal way, right? Before, it just kind of was nice to have alignment. It was nice to have sort of the doc in the room or the physician exec in the room nod their head. And now what's happening naturally on its own is the CEO is really looking to their physician leaders to drive this, right? To make sure that they are staying aligned to the business problem and the clinical problem that they're solving. And then COVID has made the importance of the care team well-being, and efficiency front and center. And so I'm really pleased to say that this is happening naturally, and that we are constantly being engaged by physician executives to say, okay, this is interesting. Now let's talk about, implementation workflow and how you can also help us change the culture. All people things, right? Not even the technology. It's like, again, what used to be a nice to have is really a must have. So I'm happy to see so many physician leaders have a bigger voice at the table than they have. And I think it's a lesson learned for the industry that if you're building solutions for the care team, physician nurses need to be the decision makers on the technologies that they're going to be using.
Right. No, that's excellent. And so, Olivia, David, Geeta, I appreciate all of your thoughts and comments. Before we move into sort of the more open-ended Q&A with some of the participants on the webinar today, just wanted to give an opportunity to any of you, based on the questions that were just, added and any of the responses, do any of you have any, distinct, follow-ups or comments that you'd like to add just based on what others have said? Well, doors open if something pops up as we move into the questions. And so with that said, as we said, we wanted to save, a fair amount of time to go into some Q&A here. And so with that, I'm going to progress to the next slide and certainly ask, Brian, from your perspective, if we can, do a round robin of some of the questions that have came up during this webinar, and our team can go ahead and that's help panels respond to them.
Absolutely. Thank you so much, Matt and Olivia, David, and Geeta for sharing those insights with our audience today. And we will now dive into this question and answer session. So as a reminder, please submit any questions you have by typing them into the Q&A box you see on your screen. And we'll go ahead and get started with this question. The attendee asks, given that Salesforce is so customizable and not an out-of-the-box solution, how can large health systems approach designing and implementing the solution in a meaningful/intentional way?
Yes, I think this is Matt. Olivia, why don't you start, please?
Yeah, I just thought I'd chime in, right, since IU Health is a large health system. I would say that, it's important before you begin to get a really good understanding of Salesforce and what it can do, understand what support Salesforce requires, and take stock of the expertise that you have access to. Side, have a really good understanding of what your health system's use cases are for Salesforce. I think it's important to do your homework prior to just, buying licenses and implementing it. Have a good understanding of what your immediate use cases are, but also flesh out what it looks like, 3 years down the road, 5 years down the road. So you have a roadmap kind of in front of you to work towards. You can manage packages of solution if there's a way that you can do that. I think that's certainly helpful. But, doing your homework and discovery prior to implementation, I think is really, really important. I will assure you, I think that's still a month's kind of timeline versus year. So I don't want to disagree with what Matt said, because I think this is definitely doable in months.
Yeah, no, that's great. I mean, one other thing that I'd add, and I think it's actually a good sort of nuance here, right, because it's a fair question, right? I think this concept of, customizable and out of the box versus configurable, right? I think what's really important is while Salesforce is a robust platform, I'm not sure I would say it's not out of the box, right? There's so much functionality that you do get day one that is configurable that actually does save a significant amount of time, right? And so things like security and roles and permissions, things that allow you to push all the capabilities into a portal or mobile app come out of the box, right? And so I think as you think about where and how you're going to get that value prop and drive a meaningful, intentional way, I think what's really important is thinking about, as Olivia said, what are the use cases, but what are also the outcomes and benefits that you're looking for? Because ultimately, if you start there and then work backwards, you're going to get the most out of it. And I think, as I referenced earlier, right, understanding that there's, relying on like others like Silverline that have done this before around a bundle that says, this is how you should do it. This is our experiences in the past. Tell us what won't work for you. Ultimately, we'll take a lot of that analysis work out of it, instead focus on where and how you can get that value as quickly as possible. But I do think it's important, because in many instances, comparing a platform to a product, Salesforce is a product as well that has many accelerators and assets specific to the use cases that we're seeing organizations needing to use today. But like any product, you will need to make sure that it aligns to your business process.
Excellent points there. Thank you both for weighing in. And the next question here sort of references a point Geeta made. So the attendee asks, To Gita's point about the technology not being cumbersome, how do you balance staff, clinical or non-clinical, now not only working in the EHR PM system, but layering on the CRM?
I'm sorry.
Yeah, so, this, I think, Dr. Nara, if you want to take it initially, and I certainly have a thought or two. But.
Sure. So again, there's this misconception that it's the EHR versus CRM, right? They're completely different end users and audience, right? The EHR is the clinical database. The end user is the physician, the nurse, the care team for the most part, but really it's meant to be a clinical database, and it's really meant to be an end user, which is a physician. CRM, the end user is really the consumer, right? So it's really the patient, and then it is all the touch points of things that can be taken off of the care team, right? So whether that's your contact center modernization, the patient journey you can put a patient on, or certain algorithms and alerts can be set to then flag for when the care team needs to get involved or a virtual visit needs to be set. So they really are meant to complement each other and not meant to be a one versus, us versus them. It really, if done correctly, is a relationship that is really focused on actually improving both the patient experience as well as the physician experience. They are tied, right? We're learning that about physician burnout. If you have a burnt out physician, I can guarantee you that patient doesn't have a good outcome and doesn't have a good experience.
Yeah, I think that's exactly right. I mean, the other thing that, I'll add, and I referenced earlier, sort of this experience-focused approach, right? One of the reasons we do that is exactly to address this. And I think, one of the things that we find is that our goal is for many, activities or workflow call that whether clinical or non-clinical staff are engaging in, because technology is modernized so much, there's a lot of things we can do where there is no toggle, there is no swivel, right? And so based on the role that some individual has, we can actually make one application be their primary application. Now, that's not going to be the situation in all instances, and that might require a roadmap to get there and multiple phases. But at the end of the day, I would say at least, more directly, the concern about people having to leverage another application certainly is something that's a factor when you think about how to drive, effectiveness into the solution. And we are actually trying to drive the best possible experience. And often the CRM actually might minimize some of the toggle, or some of the other things that people love. So just take a call center agent as a very, simple example. We see so many times we, follow and shadow call center agents, and most of them, will have Post-it notes or a binder or something that need to toggle to. Well, that might not be another system. That's someplace else that they're having to look at. Whereas with a system like Salesforce, all of that is in the system. They're not looking at another screen. They're not looking at another piece of paper. We're able to surface that information in real time. And so often, yes, the EHR is one of those systems that someone might be using, but I would think more holistically about how do we drive the most effective experience for that user or for that stakeholder. And often these tools allow us to actually ensure that the CRM might actually be that one interaction point that they're having, right? Take an example of a customer that we've worked with, that focuses in the urgent care space, right? They've actually been able to successfully create a model where the clinicians don't have to go into the EHR because we've been able to surface enough of that clinical information to allow them to do the engagement and the activities that are required in Salesforce.
Hey, Matt, one of the things that you pointed out there about the call center, I want to come back to that, and I don't think we're going to have any physicians, in the call center in the short term, but just for the call center agents that we do have, the ability to bring that real-time clinical data to them. Great example is in our Healthy CRM connector, we actually light up the next best action for this patient. That's the same insight that was calculated in the registry system that the doctor sees in his or her workflow in the EMR. We show that straight to the call center agent on the right chart panel. And I think earlier you kind of imparted that vision that said when you have the patient on the phone, it's not about closing the call, it's about the quality of the call. And to be able to engage that patient then with, hey, I see that you haven't had your annual wellness program and you're on this Medicare Advantage plan. Could I get that scheduled for you today? and the person may have been calling for a bill on a previous, encounter months ago. And then once the call center agent is trying to engage, we've created the connections into our transactional scheduling systems where we take the patient and the user and context directly into those transactional systems for fast scheduling, or even with one of our common business partners with Salesforce, Kairos, who has built a lightning component that call center agent could then be there on that one screen, not having to leave, with the ability to just register that patient while they have them on the phone. And then the last thing that we've done with Salesforce, which we're finding great utility, is the ability to message to the doctor's office and to the doctor's inbox. Because a lot of, big systems have put call centers in place. They've got agents in there, but there are questions that they take that simply the practice has to answer. And instead of playing telephone tag, we've made it easy now for the call center operator to just pop open Message Center, type that message in, hit the send key, and then often we can see the physician reply back to the message that'll go back to the patient's portal in their authenticated experience, and then perhaps the patient and the physician then end up messaging back and forth. I think it's just another example of how we're building these integrated connections.
Some very helpful clarifying points there from everyone. And I think for this next question, there'll be some more, this attendee is looking for some more clarification on this messaging component. So the attendee asks, how do you distinguish what type of messages are sent through the CRM versus the patient portal? Is there a common standard?
Yeah, so this is Matt. I can certainly take that one because it comes up all the time, right? So I think there's a few key elements that I'll address here, right? First off, I think what's really important about a CRM is there's a difference between the CRM and its associated technologies sending the message versus knowing about it. And I think that's a really important differentiation, right? The CRM should absolutely, in most instances, know about everything that is being sent to a patient regardless of channel, right? That's really, really important to create that patient 360 that we discussed. That does not necessarily mean that the CRM has to be executing all of those messages, right? And so if there's already pre-built workflow that's tied to the EHR or the patient portal where certain activities occur and that triggers a message, it doesn't necessarily mean that you should switch and now send that message from the CRM. It just means that we should take that message, attach it to that patient's profile so we know that they were contacted. So that if they call on the phone, we're not saying, hey, when was the last time you talked to us? We can say, hey, I know you got an email yesterday about XYZ. So that's the first comment. In terms of a common standard, I think we certainly see that there's certain types of interactions and activities that do make sense to flow through the CRM specifically. One example I'll give that's a pretty well-defined use case is a scenario where we worked with a customer that has 40 different locations, specialty locations, and they had 30% of their phone calls to their patient access centers were for inquiries around prescription refills. Well, their practice management system had an integration with SureScripts, and so they knew that the prescriptions were being refilled, but they weren't necessarily proactively contacting patients. That's a good example of a communication and a message that made sense to send through the CRM. So the CRM consumed that information. We associated every single time that a patient's prescription was refilled, we associated it to the patient. That set up a trigger that automatically sent an email to the patient that said, hey, by the way, your prescription has been refilled. A month after that journey, right, that communication was implemented, they already started seeing 10-15% drops in phone calls to their patient access center. And so that's just one of multiple scenarios of a good type of message that goes through. I don't think there's any message that shouldn't go through. The final thing I'll answer, which wasn't distinctly stated, but again, understanding what you can put in a message but you can't is also a conversation we typically get in, right? Even though you're using text, email, chat, whatever it is, understanding that you're not going to necessarily send an entire clinical summary to someone in an email or a text. And so understanding where that patient may need to go to access that information may dictate the right system to send that message. So hopefully that provides some clarity. I think the short answer is there's no common standard. There's use cases that make good sense. but I do think a best practice is if you're investing in a CRM, the CRM should absolutely know about all the interactions that are occurring with a patient, even if they're not actually executing those across those channels.
Thank you, Matt. And with just a handful of minutes here left, I think we'll take one more question, and then I'll turn it back to you, Matt, for some final takeaways. So this last question here then is, were there any areas of focus that needed to be addressed more than others? I'll just open that up.
This is Olivia. I can take this one. Internal education of CRM, defining what CRM means in a healthcare organization, describing what CRM looks like in healthcare, and then continually prioritizing the CRM vision internally. It's not a one and done communication. I have learned that it takes, continuous repetition to help people understand what CRM is and how it can be used to deliver a more seamless customer experience. I think there's a strong tendency to think of CRM as a tool that does one thing, but it is so much more than that. So just continuing to educate people about what CRM is within healthcare is important.
And Olivia, I would build on that also of understanding what CRM is not. Because I think that we can get into a dangerous slippery slope when we start to try to use a tool like CRM in a way that is really beyond what its core purpose is. And I think that comes back to what a comment you made earlier in the first kickoff part of this was have a plan. And I think that would be the session that I would really lead people on is know exactly, you called it the 3 to 5 year vision. I'm right with that, but know what you're doing next. What's up next? What's up next? And then how do you build the stakeholder buy-in, and then iterate quickly as you move through this.
Totally agree.
Thank you.
So Matt,
yes, go ahead.
I thought I'd add oh, sorry. So what steps should clients take to begin and expand their patient engagement journey?
Yeah, look, I mean, I think that's a nice segue, Olivia, to the takeaways here, right? I mean, I think at the end of the day, I think there's 4 key areas. Call it a point of view, call it a plan, but focus your solution in specific areas with a defined outcome, value, and a timeline, right? What are you trying to achieve, and when do you intend to achieve it, right? You're not going to be able to do everything initially, and as you've outlined, sometimes those things that might not be seen as transformative as you think will actually drive the most value. Right. The second area is, data, right? We've talked about it a lot. You cannot avoid this anymore in healthcare, right? Effective data management, effective utilization of data is going to allow you to drive not just business insights, but the right outcomes and the right experiences, engagement with your patients, providers, and other key stakeholders. The third is, enterprise platform selection is key. Whatever platform you land on, right? Use a technology that can grow with your strategy and the evolving demands and things like none of us predicted a pandemic. Well, sure, now everyone's going to be really prepared or hopefully really prepared for the next pandemic, but there's something else that's going to happen we're not prepared for, and you want to make sure that your technology allows you to be agile. We worked with a large health system in the middle of the pandemic, create a patient access center in 24 hours because the technology was agile. And the final one is people drive change. You've heard a lot about alignment and looping people in and making sure they're involved. Make sure that operational, clinical, and IT stakeholders are all involved in your discussions, in the roadmap, in the process, because ultimately that's going to drive adoption and effectiveness. So with that, I'll say thank you, and I'll turn it back over to Brian to wrap.
Thank you so much, Matt, and thank you, Olivia, David, and Geeta for that excellent presentation and conversation. And I also just want to thank Salesforce and Silverline for sponsoring today's webinar. Everyone enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you very much.
Thank you. Thank you.
Thank you.